Neck is the most sensitive and vulnerable part of your spine. Look how close your brain is to your neck, and specifically your brain stem, which controls so many of your very important bodily functions. I'm Dr. Jason Plotsky. I've been a chiropractor for over 20 years. I've seen thousands of patients and a lot with neck dysfunction and neck pain. So a lot of these things can either come from an acute injury or from long-term postural distress, just like sitting at a computer, driving into work, sitting in front of a TV, things we do day to day. And I can tell you this, if you do not correct your neck and your faulty posture, it will have an impact on you for the rest of your life. So if you want to have a healthy spine and you want to have good posture, I've created a series of exercises that you can simply do at home. And these exercises are safe for most people to do. So give them a try, see how that makes you feel, see how it affects your posture, and these are things that you can do every single day. So Jeff and I are going to show you some great things that you can do for your neck. So we're going to work on mobility first. So one of the things that we're going to do is 2x2s. So essentially what you're going to do is you're going to move your neck into flexion, so that's all the way forward. And what you'll notice with him, he's not really moving, he's not moving his whole body, he's just trying to isolate his neck. So he's going to go forward, then he's going to go back. Now with some people, looking up is, it's not that you can't do it, it's just if it makes you dizzy or if it doesn't make you feel right, you just want to avoid extension. A lot of people are tight in that direction, so you just want to go till you feel it, but you don't want to like really push it. So we're going now sideways, so side flexion, and then the other ear to shoulder, and then what we do is like a rotation, so like a shoulder check. So you go through that full range, okay, but you're going to do that 2 times. So he's going to go down again in flexion, then he's going to go in extension, and just be mindful. It's not that you can't do it. And then side flexion, so he's going ear to shoulder, and then rotation. And you might find one side's a little tighter than the other, and we're just going to keep working on that. So those are 2x2s, okay? Then the next thing he's going to do are the 45s. So what we're going to do is he's going to watch his thumb the whole time here. And what he's going to do is a 45, but as he goes back, I'm watching him to make sure his eyes are tracing his thumb. So I'm just going to move on this side. So he's going to go 4 on each side. So you're following your thumb, and he's making sure he's going up and back. Yep, that's perfect. So he's going to do 4 on that side, then 4 on this side. It's perfect. Then what we're going to do is palm up, palm down. So what you're going to start with one palm up, one palm down, and you're going to start looking to the palm up side. So then what he's going to do is switch. So this is really, really good when people have tightness in rotation or doing shoulder checks. And this is really good to do as a break too if you're sitting a lot or you're driving. When you have a minute, you can do these. That's perfect. So that's palm up, palm down. So that's really good, again, to get tension out of here. Now from this position, what Jeff can do, we call this phase 1 extension. So what he's going to do is he's going to use his back muscles to lift his shoulders up and get his arms off the ground. So you can do this, if you can't get on the floor, you could do this on your bed, that's fine. And then the only thing we have to be careful here is just the position of his head, okay? So we want to make sure, I'll show what we don't want. So we don't want to go into like too much extension because that could really jam the neck, but we do want to get the head at least to looking horizontal right there, as long as that doesn't give you any pain in the neck. And so what we're doing is we're trying to build up strength and endurance here in these postural and spinal muscles. So that's what we would call phase 1. So basically when you can hold this for about 45 seconds, you would be ready for phase 2. Phase 2 is we're going to start now to look over each shoulder. So you're actually aiming for your heel. You may not get there, and it may feel different one side to the other, but you want to go very slow. Okay? You don't want to do this too quickly. So you're looking over the shoulder. And what that's going to do, when you start to look, it really increases the contraction of the spinal muscles, but it also works on the range of motion of the neck, which is really important. So that's a great one. The other one you can do, as long as you have decent shoulder mobility, is Superman. So Jeff's going to put his arms out in front, and what we're going to do is a cross crawl pattern here. This is really healthy for the nervous system, and it's great for the spine. So what he's going to do is he's going to go opposite arm, opposite leg, and hold for a 2 count. 1, 1,000, 2, 1,000, and then do the opposite side. And ideally here, what you're shooting for is 20 on each side. So sometimes we have neck pain, but the dysfunction could be somewhere else in the spine. It could be in the upper back, it could be weakness. So what this does is it really starts to get a baseline for stability and strength of the muscles along the spine. So even though this works muscles along here, it's also very, very, very healthy for the neck. Okay, now Jeff's just gonna flip over on his back and we're gonna show you a couple things you can do here. So from this position, what we're gonna do is show you what 90-90 looks like. And now he is not immobile, but a lot of our patients are. So what he's gonna do is try and get his hands flat to the floor. And as you can see, his shoulders and elbows are at 90 degrees here. So the reason this is so hard for so many people is because these muscles, pectoral muscles and the anterior part of the shoulder, the tissue there is just so tight and rounded forward from sitting at a computer or driving all day, that what this does, it really starts to reset the shoulders and it resets the neck. Now in this position, what we want to do, the back is flat, and what I'll have patients do in this position is what we call diaphragmatic breathing. Now this is really important because a lot of the times if we've been in pain or if you're someone that gets a lot of headaches or you sit at a computer a lot, because of our rounded shoulders, we start using accessory breathing muscles like the scalenes in front here to try and move the ribs. And if you do that for too long, what happens is you start to get tension through here. So this is a reset. What we do is we want to try and breathe from our diaphragm. So what he's going to do from this position, he's going to use his belly to go up and down. Okay? So as we drive the breath from the diaphragm, what happens is we start to shut down the muscles of the neck. And the other reason this works so well is because you're doing two really healthy things here at once. You're starting to loosen up the tissue in the front and the diaphragmatic breathing. This is going to help reset the posture. So if you're in a situation where your shoulders are very tight, let's say Jeff couldn't get this left arm down, he could prop it up with a pillow or a book around the elbow, and that would relieve pressure here. So if anything got like really sore or stiff in the shoulder, he could just prop it up. If you find for whatever reason, some people have vascular issues or nerve issues, if you get any numbness or tingling with your hands in this position, then you basically just take a break. So you bring your arms down, but you continue to do the diaphragmatic breathing. Okay, and what you want to do here is spend at least a few minutes every night if you can doing these nice, slow, deep breaths. What they've found is that when you start diaphragmatic breathing, you disengage your sympathetic nervous system, which is your fight or flight system, and you start to engage your parasympathetics, which is your rest and digest. So this is a really, really helpful thing before you go to sleep, because what you're doing is you're unwinding from your day and you're getting your body ready to rest. So usually if you do this before you go to bed, it'll help you sleep.